Before we start, I would like to learn, are there any founders here? Anyone who is a founder? Okay, those 2, 3, 4. Are there any people who are considering starting your own startup? Don't do this. This is the best advice I can give you today. No, I'm kidding. That's a great adventure. You can try it, but it costs a lot, and you will spend a lot of sleepless nights on that. So, Healthfolder. This is a startup that I started some time ago, but usually when I'm pitching the startup to investors, I start with this sentence that over a year ago I was diagnosed with cancer. And actually, this is a true story. More than a year ago, I was diagnosed with cancer. Fortunately, that was very early stage, and actually, after more or less than 2 weeks, I was clean from my cancer. There was surgery performed on me, and I was okay. I'm okay till right now. I'm under control, and everything seems to be good. But the problem was that the problem is actually that not everyone is so lucky as I was, or actually it wasn't luck. I was pretty aware of the risks that I may have. And I was testing myself regularly, which means like every 3 to 5 years, I was performing some medical checkups on myself. And during one of these checkups, I found out that I have a cancer. So what is Healthfolder? Healthfolder aims to be an AI-driven medical platform for people who want to live longer. Our goal is to help patients in prevention and in proactive healthcare, as well as we want to help doctors in the diagnosis and in guiding their patients. And at the end of the day, we want to create a marketplace both for doctors and patients with the medical services. The thing that we are doing right now is already known as a medicine 3.0. A medicine which is focused on prevention and proactivity instead of just treatment, which is usually medicine 2.0. You can imagine that since people discovered antibiotics, this is the moment when we can actually say that the medicine 2.0 started. And actually, thanks to antibiotic, antiseptics, and other medicines, our lifespan doubled since early 19th century. Sorry, and early 20th century. Okay, but why are we doing this? As we sit here, 80% of us will most probably die from one of 4 reasons. Yeah, sorry, that's the bad news. So that's the bad news. Yeah, like most of us will most probably die because of the cardiovascular diseases, cancer, neurodegenerative diseases such as Alzheimer, dementia, and some kind of diabetes and diabetes-related diseases. That's the bad news. The good news is that all of those, let's say 4 horsemen, all of those sicknesses, all of these diseases could be treated or could be managed, but only if they are diagnosed at the early stage. So most of people are dying because of stupid reasons, because they are not diagnosing themselves. And this is why we are mainly doing, mainly working on Healthfolder. But that's all about the product and product placement. If you would like to download the app, at the last slide, there will be a QR code for downloading it. For now, the app is pretty simple. It doesn't do all of what I said. It's just a basic app that allow you to upload your medical documentation, and it digitizes it, and you can share it with your doctors, which is already gaining you around 7 minutes on average during each doctor visit. So you have 7 minutes more to ask questions about your condition to your doctor, which I believe it's pretty beneficial as well. Today I would like to share with you a few lessons that I learned. It will be a very short presentation. I'm counting on your questions at the end. And of course there is way more lessons learned than those few. But let's start with the first one, that I've started Healthfolder using my own money. We bootstrapped it together with my business, with my co-founders from another company, which is a software house, software development company called Pragmatic Coders. We spent around 1 million zloty on building the startup. It's a lot, to be honest. And actually, I've learned that probably around 600,000 was wasted from that million. But that was one of the lessons, and that was a very costly lesson. We learned a lot, not only about the value of money. We always thought that that building startups could be cheap. We always preach it to our clients who came to us, to our customers, and we always saying that okay, to build a startup you need something around $100,000 to build a startup. Well, no, it's not enough. Usually you need a little bit more. I would say that 200 is something that will allow you to actually at least get to the point where you will have some kind of problem solution fit, not necessarily product market fit, but problem solution fit. By the way, Healthfolder right now is at the stage that we have problem solution fit. We are already working on the product market fit, where we have the first few paying customers, but still it's not the level, it's not the stage that I could honestly say that we are able to make money and bootstrap this product without the help of investors or without extra funding from our own money. So like if you would ever try to bootstrap startup using your own money, well, you can try do this, but I would rather recommend you to start fundraising as soon as possible. And of course, fundraising depends on the stage, not the stage you are, as many people think, but fundraising capabilities depends on the stage the market is. Like fundraising 4 years ago or 3 years ago, when the market was high, especially VC market, all of them had a lot of money to spend, and a lot of them wanted to spend the money pretty fast. Fundraising was much easier than in the last year and last year and a half, when the market was down and actually all of the VCs on the market didn't have any money in their budget. They were just telling a lot of bullshit stories, what they need from you to invest into you. But when I was honestly asking, okay, but do you have money to invest? They were saying, no, not really. So bootstrapping is a good idea depending on what the market condition is at the moment. And actually what I learned is that it doesn't matter how much money you spend, it matters what results you can generate, regardless the money that you invested. So searching for the low-hanging fruits and investing money in a way that you will have some results very early, you will test some hypothesis very early. By the way, do you know what the hypothesis is? Richard Feynman said, the famous physicist, not physician, physicist, there's the difference, said once that hypothesis is just a guess, but better named. So the more guesses you can test, if you spend less money on testing each of these hypotheses. So that's good. And when you're using your own money, you, at least in theory, should be more aware of the value of this money and how you are spending it. In reality, it doesn't work that way. Okay, so by the way, I'm also running a podcast which is called Pragmatic Talks. You can subscribe to it. But where I'm in this podcast, I'm also preaching about how to build products, how to build startups, all about agile and other stuff. It's easy to say, it's much harder to do. And what I learned during last year when building Healthfolder was that I thought that founders are the best product owners, or the best product managers. And especially when they have experience as a product owners and product managers, as I did. I had like a few years of product manager experience in the past. I was building a bunch of products for my clients, for people I was working for. Some of them were more or less successful. So I thought that if I will start building my own product, I will be awesome product owner, probably the best product owner ever. But soon I learned that it's not so easy. And actually, This video was recorded a few weeks or even months before I realized that I am not so great product owner.
Founders are liars. I'm a founder too. Founders love to lie themselves, lie to investors, lie to everyone else, their friends, family, all of the people who are supporting them, their teams, that what they are working for is something that is worth to be invested into their time, their energy, etc. And they are lying themselves that it's worth to do this. And until it's not in production, until it's not launched, it's true. It's not a lie. Only in the moment of launching, only in the moment of validating the hypothesis with real markets, real people, real users, founders are checking if they've been lying or if they've been right and their hypothesis was right and correct. Until the launch, founders are liars, not liars in terms that they are lying consciously. They are unconsciously lying themselves and others. In the moment of launch, there is a validation moment when people, both founders and other people around, learn if they've been lying or not. Be sure to catch all new episodes. Subscribe.
So as you can imagine, I was delaying launching our product as long as possible. And I realized it's, after rewatching this video about 2 months after it was recorded and month after it was released, I was watching this video and was like, fuck, I'm doing this. I'm lying myself, I'm lying my team, I'm lying my business partners, I'm lying investors that I'm building something that is great and that will be great, which is not necessarily true because we haven't tested it yet with our real users. So that was this one, or?
Founders often...
Yeah, so that was about the product owners as well. And this is why you need a product owner. Yeah, when you have a product owner, product manager who you hire for that role, who is not personally involved into building this startup, building this product, but whose job is actually to cut the corners, to go to the market as fast as possible. And even, you can set up some OKRs or KPIs on that. Then such a person has a totally different perspective on what to do, how to do, and how to build the product.
Are delaying launching the product. They're trying to make it perfect. And there is nothing wrong in doing things perfect. But perfect needs a lot of time and needs a lot of money. And when you're a startup founder, often you don't have neither time, neither money. It's better to launch something that is good enough, not perfect yet, and see what direction is, because you may learn that nobody likes it. And it's not because it's not perfect, it's just because it doesn't solve any real problem. You already learned something that way, and you can change the idea, work on it, and reiterate and do this once again. But if you are going to do something perfect and spend a lot of time on it, you will end up with building something that there is a high chance that people will not like or will need to be adjusted, even that you thought that it's already perfect. Perfection is okay, but not necessary in building the startups. Be sure.
Yeah, so this is what I was doing. I was delaying the launch of the product. I was trying to make it perfect. We've run some, beta tests with our users, some interviews, and we always heard like, oh, if there would be only something like this, okay, let's add it. Let's add it more feature. And then you can think that, and I heard it like many times from startups that, Scrum is not for startups. Like, we have a better way of doing things. Like, who cares about processes? We are just, hackers who will be hacking it, talking to the customers, iterate very, very fast, move fast, go to production, etc. And except the last one, go to production, because founders are liars and want to do everything perfect. So they will be like doing all of this stuff and not going to production. And in this history, at some point, I asked one of our colleagues who is a Scrum Master to join our Scrum meetings, let's say Scrum meetings, like sprint reviews and sprint retrospective. And we had this planning where we were planning like, oh, we need to do this feature and that feature and other stuff, and like a plan for the next couple of weeks. And we still haven't been on the production yet. And this guy just, looked from the outside and he just asked, okay, but does it move you closer to your goal? And we're like, goal. And he was like, so what is your goal? Well, we need to first validate if anyone would like to use this application and upload any medical documentation there. Is it moving you forward towards this goal? No, not really. Okay. And he asked another question, which was a brilliant question. Is there actually anything that is stopping you from going to production and checking if people will upload it and upload the documentation and if they will like your application or not? Well, actually, we just need to fix these 5 bugs here. Yeah, and how long will it take? Well, it should be ready like a day after tomorrow. So I think we have a release day. Yeah, and that was, like we were planning to spend another 4 or 5 weeks on development, spend another like 120,000 zloty on building new features before we will be able to release. And at the end of the day, we have released very next day to production. But actually, we realized that we were able to release like let's say 1 month earlier, or even 5 or 6 weeks earlier than we actually released. So I never thought that I would say that, but Scrum Masters are really useful and really helpful in startups, or at least inviting someone from the outside of your, let's say, war room or war zone where you are fighting to just, ask you 1 or 2 not so stupid questions and help you to move forward faster. Another lesson that we learned was that we spent a lot of time on implementing some kind of surveys, fake doors in the application, just to check if our users, we already had at this time more than 1,000 users in the application. So we wanted to check which features should we implement so they will be willingly paying for the app. So we created a bunch of fake doors. You know what the fake? Oh, you don't know. Sorry, I tell you. So the fake door is something that you imitate that there is a feature, like you put a button. So when people expect that if they will click it, they will see something, or you mock something that is not working yet, and you're all telling people that, oh, sign up here for the paid subscription, and then we'll develop it, and you will get an access to that. The mistake that we made, we were just, asking people if they would like to pay for that feature. And like most of them said, like, for example, we had like a family profiles, which are already implemented in the application, or historical analysis, which is when you put your medical test into the application, there are some historical graphs, histograms of each parameters drawn in the application. We ask people if they would like to pay for that, and then in the next step we ask them to move the button and tell us how much would they like to pay for that. Brilliant idea, yeah? And based on that we decided how much we should charge them for the premium subscription later on. The reality was, at the end of the day, after we released like a 3 or 4 this kind of premium features that we knew that people want to pay for, we realized that actually they do not pay for it. So at the end of the day, people were started paying us only when we limited the number of documents that they could upload to the application. So after they uploaded like 20 documents, 21st was paid, and that forced some of them to pay for that. Later on, we removed that limit as well and added a few more features in the premium version. So right now we have around 25 paying customers, which is not great yet. But it's an early stage startup. We are fundraising right now. Our vision is big, and we want to make something great. Sorry? Don't lie. It's not a lie. Another thing that I learned from the startup journey is that UX designers. This is like a huge trend. Product designers, UX designers. This is something that everyone is talking about. So we also decided that we need to have among the 3 people on our payroll, one of them was full-time UX designer. UX researcher, UX designer, a person who was committed 100% of her time to do the UX research, to talk to the customers, interview them, write down some reports, design the features, test those features on the mockups, etc. with the users, and then put it into the implementation so developers could work on it. And you would ask, like, what could possibly go wrong? What do you think? What could possibly go wrong? Yes, we didn't solve the problems of our users at the end of the day. No, that wasn't a problem. You know, we were self-founded, so we have a lot of money to waste. No, that wasn't a problem. So actually, you know, the problem was that the entire knowledge about the user's problem was in the head of one person. So she was the only one who actually talked to the users, and we were living in this fantasy that we know what our users want, but actually we only knew what our designer thinks that our users want. And later on, when she left the team and there was 2 developers and me alone, we started talking to our users on our own. And I'm not saying about myself, but developers, you can imagine, developers were talking to users. Unbelievable. I forced them. I told them that I will fire them if they will not. But when they started talking to the users, it occurs that there's a bunch of things that we were missing. A bunch of like small problems, even in the in the UX, in the user interface, that were confusing for users. That was extremely easy to fix by our developers. When they saw it, even during the testing, they were committing the changes to the application that was fixing these things that they were ashamed of that they implemented. Yeah? So that was crazy. And when we started talking to the users, it occurs that there is a bunch of other things that we do not have money anymore to implement in the application, but would be worth to do. So, but it's all about learning. And limiting talking to the users only to the UX, and I'm not saying that UX people are doing it wrong. I'm saying that they are experts in doing UX research, UX interviews, etc. But limiting contact with users only to such a person might be really harmful for your product. So this is something that I would recommend to you that everyone should talk to the users. Everyone should at least once upon a time participate in the user research done by the professional UX designer, UX researcher. But aside of that, do not block the contact with your users. Do not put their UX designer between the users and the team. The whole team should talk to the users as often as possible. There are a bunch of tools, bunch of methods to design this kind of conversation, and it doesn't need to be a professional UX interview, professional user experience process. It could be just chit chat about how do you use the application, what type of applications do you use, are you paying for another application, for what applications are you paying for, etc. By the way, Kasia mentioned earlier about the it's called silver hair generation. Those are our users mostly too. Aside of usually the average is something around 58 right now. So we have people who is 40, sometimes much younger, which are usually women expecting child. Who are younger, and then 40 plus, and the oldest users that we have is 88 years old lady who is using smartphone better than me. So I have recording how she's using it, and it's awesome. One more thing that our UX designer didn't discover during this process was that what already Kasia told, that most of these people have problem with the accessibility, and they have these huge fonts in the phone, and our app wasn't ready for that. Actually, it's not perfect yet as well. Another lesson learned is that do not ever believe what developers says. They are lying even more than the founders. Developers will always tell you that, you know, there is huge legacy code, technical debt. They need to do refactoring. Oh no, that this technology sucks. It's impossible to move forward fast with this technology. We need to rewrite it to this new shiny framework that would just have been discovered somewhere, developed, etc. It's bullshit. We had this idea. We started the application in the no-code, which was called Adalo. And it was pretty bad tool for building startup. I wouldn't recommend it anymore to anyone. And that was actually something that the developers were saying that it's quite good. I told them that it's impossible to move forward, so move forward faster. So we changed the technology and rewritten the application from scratch using Flutterflow. And then after a couple of months, they told me that Flutterflow is a piece of as well, and it's impossible. It's slowing them down. It's impossible to move forward faster, etc. I was like, I do not see the same as I saw before with Adalo. I don't see the same problems. So why do you telling me that it's slowing you down? Okay, it's slower than it used to be at the very beginning, but I think we are still moving forward pretty fast. And they said, no, it's all because of this no-code, low-code that is slowing us down. There are a lot of conflicts, a lot of bugs, etc. And then I look into the data. I opened the Jira. I choose like a 40 random user stories. When we write user stories, we have like a user story and then subtasks for like some front-end part, some back-end part, some UX testing, etc. And I look deeper into this subtask, and I learned that among 40 stories, there was only one where the backend part was finished before the Flutterflow. So Flutterflow, the mobile app, wasn't a bottleneck for us at all. Even that developers noticed that they are like twice, the pace is twice slower than it used to be at the beginning. So still, this tool was much faster than the regular coding in backend. And I believe that they wanted to, just to move another shiny new technology and learn something new, which they actually learned over hours as far as I learned later on. Another important thing is that never trust investors. I was trying to fundraise almost from very beginning. I've heard a lot of different stories from investors. I have a lot of good advices. I heard a lot of promises from investors, such as, oh no, when you will have like 2,000 users, we'll definitely talk about investment. Okay, 3 months later, 2,000 users registered. Oh, would you like to talk about investment? How many of them are paying? Okay. How many should? Oh, even if we'll have like 10 or 20 paying. Okay, no problem. 3 months later, hey, I have 30 paying customers. No, customers? You don't need customers. You need to have like a big appealing vision. And couldn't you tell me that like a half year ago? Yeah, like I would have like a big appealing vision, etc. So investors will always tell you something that will be dependent on as I told you at the beginning, something that will depend mostly on the market situation that they are in right now. So if they do have money, they would invest into your idea even without any product. Of course, you need to pitch to right investors. I mean that there are different investors who are investing at the idea stage. There are different investors who are investing at the later stages, etc. But but in the good times, it's pretty, let's say, easy to find investors. In the bad times, it's extremely hard to find any investors, regardless your idea and the potential that the idea has. So do not talk to investors, especially before they commit, or especially before they, let's say, became your advisors. This is another thing that you can figure out, that you can hire an investor as an advisor before they commit with money. And then they have some commitment, so then they will give you pretty good advices as well. And as I said, yeah, like for the investors, it doesn't matter what you actually have built so far. It's more about the vision and and the results that you generated. And actually, at the end of the day, especially at the early stage, from what I see, it's more about the people, more about team, and the potential that is behind the team, and things that the team proved so far. So investors trust that you will move forward and that their investment will be used in a way that will generate some profit for them at the end of the day. So actually that's all that I had to say. It doesn't mean that it's all that I learned, but I would love to hear your questions.
Thank you so much. If it's not confidential, you mentioned about the AI. Could you shed more light? How does the AI is implemented in Healthholder?
Yeah, so far we have a pretty simple model that is categorizing all of the medical test results that you're uploading to the application and put it into the database. It's simple as that. It's not so simple to train, but we managed to do it. But what we are currently working on is the model that is doing way more than that. For example, when you share the documentation with doctors, we are working on a panel where the doctor do not need to go through all of your documentation, but they will have like a synthesize the most important things about you, like your medical history, the things that recently changed and they should pay attention to, and a bunch of other things like this. So this is what we are working on right now. Also, we are working on we will work on our backlog. We'll be working on the algorithm that will be matching you with the expert physicians in the particular domain that is that your condition requires. So this is something that we want to be like a matchmaking platform for. So you don't need to search for the best, let's say, surgeon in this for kidneys, but we will show you that those are top 3 surgeons in Poland that you need to consult because they are pretty aware of the condition that you are in. You can download the app.
Yeah.
And subscribe.
Maybe I'm not a part of your target customer because I'm too young for that. But
Lucky you.
I really like the idea. But my biggest concern would be the privacy because you have a lot of sensitive data, and combining this with AI is pretty dangerous for privacy of the user. So how do you manage to tackle this problem?
Yeah, so this is the question that's very often pop up, and I'm not surprised that was the first question that was asked. Yeah, of course. Like a privacy is something that we were working on from the very first day. So we store our data, users' data, in the encrypted form. So this is one thing that in terms of even if there will be some leak of the data or something, the data will be encrypted. This is one thing. In terms of the training AI models, the models that we are using are private, so the data are not moved anywhere. And the third thing is that user need to, during the registration, user need to agree to use his data to teach the AI models. If you don't agree for that, we won't be using this data for teaching the algorithms, but they will be read by the algorithms. But reading the data like OCR and then categorizing is not actually not impacting the AI model at all. So your data will not be they will be read, but that the AI will not use them for anything. So this is at least what Microsoft say, because we are using Microsoft models. Yeah, that's Microsoft, yeah. But another important thing is that in terms of the medical data, this is pretty funny, because I've also thought that that medical data are some kind of special data in Poland or in Europe, but actually at the end of the day, according to the law, it's just a special category of personal data. And actually what the lawyers told us is that in case of a leak of this data, the problem is not that someone will learn that, for example, I had a cancer. The problem is that on this document there is my personal number. And this is the biggest problem from the legal perspective, which was crazy for me, because I also thought that that medical records should be treated specially some kind. Yeah. Thank you.
Okay, so I have 3 questions. So first, regarding the AI, okay, machine learning, but you need to have data, enough data to predict, not predict, but AI is 80% accurate, 80-70%. So how you provide data to to be your application accurate 70-80%, and even that you have 30% of not accuracy. Yeah, so how do you provide that?
So the model that we already have is if there are like PDF files or good quality pictures of documents, we are able to read the medical documentation at the level of around 98% of accuracy, so it's pretty high. The only some specific documents that we haven't seen before, like sometimes some hospitals has some special formats for documentation, and this is something that our AI is not able to read properly. Secondly, we always ask our doctors in the portal that they shouldn't trust the results in the database. They should always check the original file that is also stored and visible in the panel. And thirdly, user always has the possibility to edit the result that was automatically written by AI. So if you upload the document and see that something is wrong there, you can edit it manually and fix after the AI. We haven't, because of the budget, we haven't implemented reinforced learning, because we could do that. Like whenever user is improving it, we could improve our AI, but we haven't implemented that. And in terms of the thing that I was talking that we are working on right now, we are trying to do this in a way that it never will be a diagnostics tool. So you will never be diagnosed by AI. It's only the tool that supports doctor in terms of browsing through your documentation and setting up diagnosis. We will never suggest to doctor that, oh, this patient most probably has cancer. No, we only tell, take a look at this particular test results because you should pay attention to it because there is something wrong or there is some trend that is going down. Also, what is pretty important that I learned in the last year when I was working with doctors is that most general practitioners, general GP, internista in Poland, what they are doing is mainly working according to some algorithms. Like it's not very, sometimes it is pretty creative, but mostly it's like there are few books like such a thick where they are described like if the patient has that, you need to perform this test. If the test result is that, you need to do this. If the test result is different, you need to go that path. So it's more algorithmic than creative. So some part of what we are doing right now could be actually implemented not through the AI, but just through the regular algorithm, which will be 100% accurate in most cases. So it all depends which direction we want to go or which problem we want to solve. Then we'll be working on it. But you're right. Like we won't be 100% accurate with AI. Also, well.
Okay, so my second question is, did you do at the beginning design thinking before you started your, okay.
We did it after 3 months.
Okay.
No, so it was like it was jump start, yeah. Like there was the idea, and we have a team. Let's go. Yeah, let's start up.
Yeah, okay,
yeah, we made all of these mistakes, but we stopped at some moment. We stopped. Yeah, we said, okay. Now is the moment to do the workshop. Now is the moment to do design thinking. We spent like 2 weeks on that, and that was also the moment we changed the technology. And actually, the second prototype, because the first one was pretty rubbish, and there was a lot of. Actually, the application right now has less features than the prototype that we built at the beginning, because we realized that most of that was totally unneeded, and we decided to remove it after the design thinking workshop and other research that we did at that time.
Okay, my third question, because also I don't know if you hear about QFDA, Quality Function Deployment. So this is something that I don't know, maybe you heard about that?
No.
Okay, so you have the customer needs and also what you can provide, yeah, and cross-check what you're able to do, what are you not able to do, and this is something that in the engineering, prototyping, for example, the machinery, not only, but you can use it in all engineering stuff. This is really useful and help at the beginning if you are doing something to avoid,
if you are not jump starting
work, money, etc. So also I am mentioning about that because if you would like to start a startup, yeah, it is nice to know that there is something like that, and this is a tool that you can use it.
We are using, for example, opportunity solution trees, which I think is quite similar to that. Not necessarily the same, but quite similar to it. But I haven't heard about it. I will take a look at it as well.
Okay,
Thank you.
so probably you didn't have any project manager.
As I said, yeah, I thought that I will be great product manager for that, and I'm sure I wasn't. This is my recommendation to anyone, to always hire a product manager. And I can even imagine a situation that we wouldn't have developers, but we will have the product owner or product manager full time, and will most probably generate more value than we did with a team of developers and UX. So right now I'm like a 200% sure that any product need to have a separate product manager who is focused only on product management. Mm-hmm.
Hi, this is Cesar. I wanted to ask, like, how would you differentiate your product from some like kind of drive, let's say Google Drive, right? Mm-hmm. So I could just create a folder there calling health and put all of my PDF results and so on in there. Like, what makes your product unique? Because this part I missed in this today's call.
First of all, you can display your medical records in a more readable way for your doctor, and you can share it in a much easier way than your Google Drive. I will try to, I will not try to. I will try to show you how does it work. So, for example, when you go to the doctor, you just ask him or her to go to this website. I could go to the English one, but I choose this one. And in your application, you only need to click the button to share the documentation. And you won't see it, but here is like a 6-digit code. It works pretty similar to Blik payment in Poland. Yeah, so 144779. And now I need to confirm that in the application. And voila, the doctor has an access to my documentation. As you can see, like 3 days ago, I have CT scan and everything is okay still, so I'm pretty happy. But for example, if I would like to check my, let's say, TSH level, I don't need to browse through documentation. The doctor has all of my TSH results already here, and he can see that it's changing in time, but it's okay still.
Got it. Just follow-up question: do you have direct the data flow link from these laboratories that tests are coming here automatically?
Not yet. We are working on.
Did I just give you an idea?
yeah. We are working on that. The issue is that laboratories also try to have their own systems like that. The difference between, like, you ask how we differentiate from others, how we differentiate ourselves from others, is that we are totally independent from the medical data providers. Like, our data provider are users at the first place. We are also working on, or we were exploring the integration with the Internetowe Konto Pacjenta, the Polish government portal.
Yep, that was the second question. Yeah.
So we're exploring that. That's possible to be done. The only problem is that from the legal perspective, the government never predicted that there will be someone crazy enough, except the medical facilities who are obligated to do that, to actually integrate that. So from the legal perspective, it's pretty hard to do. So the doctor who is in my team, actually, I haven't mentioned that, but at some point in time, the doctor who was a surgeon who performed the surgery on me joined me as a co-founder in this startup, which is also a nice story. So if we would like to do this, then this doctor would have to sign off under all of the data that we'll be taking from the government system. Another problem is that, actually, I don't know if you ever check your Internetowe Konto Pacjenta, there is almost nothing there. So integrating with them at this point in time doesn't make a lot of sense for us.
Yeah, got it. Thanks.
Thank you.